If you've ever found yourself dealing with widespread pain, that deep down fatigue, and just that frustrating brain fog, you know just how confusing and overwhelming it can all be. It feels like your body is screaming, but what is it trying to say? Well, today we're going to dive into two conditions that often get mixed up because they share these symptoms: lupus and fibromyalgia. And this right here, this is the question at the heart of it all, isn't it? It's that feeling of how can this intense pain come from such different places? It's a valid, frustrating question. And our goal today is to really break down that why and bring some much needed clarity. Yeah, these are the big three, right? The widespread pain, the kind of fatigue that sleep doesn't touch, and that cognitive fog that makes it hard to think straight. They are the core of the confusion, the reason it can feel almost impossible to tell lupus and fibromyalgia apart from the outside. And let's be really clear about something. Getting the right name for what you're feeling, it's not about just slapping on a label. Not at all. Think of it more like getting a map that finally shows you which path to take for treatment, what to watch out for, and how to navigate this whole journey. Okay, so let's start with the absolute fundamentals. What are these two conditions really? What's actually happening inside the body that makes them so different, even when they can feel so darn similar? So first up is lupus, and the best way to think about this is like a case of mistaken identity, but happening inside your own body. Your immune system, which is supposed to be your defender, gets confused. It starts creating these things called autoantibodies that attack your own healthy tissues. And that attack causes inflammation, which can pop up anywhere: your joints, skin, kidneys, you name it. Now, contrast that with fibromyalgia. Wow, it's a totally different story. The problem here isn't an immune system attack, it's more like a faulty alarm system. Your central nervous system has its pain volume knob turned way up. This is a process called central sensitization, and it basically means your brain and spinal cord are amplifying every little pain signal. That's why the pain feels so widespread and so intense. Okay, so this table really puts it all side by side. Look at how everything flows from that very first row, the underlying mechanism. For lupus, it's autoimmune inflammation. That means we can find clues in blood tests, and there's a real risk to your organs. But for fibromyalgia, it's central sensitization, that volume knob. So the diagnosis is based on your symptoms, not a blood test, and the treatments focus on things like exercise and therapy to help turn that volume back down. So knowing that, how in the world does a doctor actually figure out which is which? Well, that brings us to the diagnostic process, which, as you can probably guess, looks completely different for each of these conditions. When it comes to lupus, doctors are basically detectives looking for clues, physical evidence of that autoimmune inflammation we talked about. They're looking for telltale signs like that classic butterfly rash, joints that are actually swollen, or your symptoms getting worse in the sun. Then they back it up with hard data from blood tests, like the ANA test, and urine tests to see if any organs are being affected. And then you have fibromyalgia, which is a whole other ballgame. There's no single blood test that's going to light up and say, here it is. Instead, the diagnosis is all about your story. A doctor uses specific criteria, like mapping out where you have pain and for how long. It's a process of listening, assessing, and very importantly, ruling out other things, like lupus, that could be causing the symptoms. And this right here is exactly why getting that diagnosis, that map, is so critical. Because once you know if you're dealing with inflammation or pain amplification, you can finally get on the right treatment path. And trust me, those paths could not be more different. Just look at this. The goals themselves are on two different planets. With lupus, the whole game is about defense. Calm that overactive immune system down to protect your vital organs. But with fibromyalgia, the goal is all about improving your day-to-day life, managing the symptoms, turning down that pain volume, and getting you back to doing the things you love. So to hit that defensive goal for lupus, the treatments are heavy hitters. They're designed to tell the immune system to stand down. That fire department analogy is perfect here. Antimalarials help prevent flares, the fires, from starting. Steroids are like the foam that puts out an active fire fast. And for the really serious threats, you bring in the big guns like immunosuppressants. Now, the fibromyalgia toolkit, it's less about suppression and all about management and retraining. Things like graded exercise and optimizing sleep are absolutely foundational. Certain medications can help calm that hyped-up nervous system, and psychological tools like CBT can give you real practical strategies for coping with chronic pain. It's a true multi-pronged approach. All right, we've talked about the what and the why. Now for my favorite part, the practical stuff. What can you actually do with all this information? This section is all about building a toolkit you can use starting today to navigate your symptoms and advocate for yourself. Walking into a doctor's office can be intimidating, but having the right words can be a game changer. Take a look at this script. It's so powerful because it shows you've done your homework. It opens up a collaborative conversation, and most importantly, it pushes for a plan B if the lab tests come back normal, but your pain is still very, very real. Okay, this one is so simple, but I promise you it is incredibly powerful. This 2-column diary basically turns you into a detective for your own health. By separating your symptoms like this, you start to see patterns. Are my bad days driven by inflammation signs, or is it more about the widespread pain and terrible sleep? Bringing just 2 weeks of this to your doctor provides more useful information than you can imagine. And to really level up those doctor's visits, you've got to go in with a plan. Think of this as your pregame checklist. You've got your diary, your medication list, a few specific questions, and my favorite one, a single one-sentence goal for the visit. Making your goal that concrete, I want to sleep for 6 hours straight, makes it so much more actionable for both you and your doctor. Okay, and I really need you to listen closely to this last part. This is incredibly important. We have to talk about red flags. These symptoms on the screen are not things you wait on. They are not things you see how you feel tomorrow. They can signal very serious organ involvement, especially with lupus, and they mean you need to seek urgent care. Knowing these could truly be a lifesaver. So you see, naming the problem isn't about being stuck with a label. It's about getting a starting line for a real plan. It's about getting that map so you can finally start moving forward. So my question for you is, after everything we've talked about, what's your first step going to be? Thanks so much for joining me.